Today I'm going to talk about managing diabetes for a better quality of life. And I'm introduce myself, I'm Dr. William Smith and I work with Cornerstone Endocrinology. So the lion's share of my presentation, a lot of the information on the slides is actually available from the Department of Health and Human Services. Their latest edition, unfortunately, was 2007, but it's called Taking Charge of Your Diabetes. And most of the guidelines these days are around 2008. So, we patiently await for updates as they come. But I still think all the information from this handout that I used to kind of form this talk is still pertinent and poignant today. So let's just talk about diabetes itself. About 26 million children and adults have diabetes in the United States. That makes up 8.3% of our population. About 9 out of 10 are type 2 diabetics, and 1 out of 10 is a type 1 diabetic. But about 19 million are diagnosed with diabetes, and 7 million people are undiagnosed. And a scary point to me is that there are 79 million people out there that actually have pre-diabetes and are potentially on the verge of developing diabetes. But there were 1.9 million cases diagnosed in 2010. And a lab test that we check in the lab on your quarterly visits is called a hemoglobin A1C, and we're actually using that now to diagnose diabetes. Well, this presentation isn't about me, it's about you, and it's about your family members and friends and everyone involved in your diabetes care, okay? But don't fret because you have help. And my hope is that us at Cornerstone and also the community, that you have resources and individuals that can help you with your diabetes. And that includes your physicians, pharmacists, the nurses and nurses assistants that work in our offices, our receptionists, diabetes educators, nutritionists, your foot doctor, your eye doctor that you see once or twice a year, and even community health care workers. They're all important for managing and helping you manage your diabetes. I wanted to throw this in, and I can show it at the end again. This is a checklist of the type of things that your doctor should be doing for you as part of your diabetes care, and I see a lot of familiar faces here. And these are the type of tests that I'm responsible for making sure, and these are the questions that I ask on every visit, and these include, have you gotten your flu shot? Have you had at least a yearly eye exam? Have I done your foot exam within at least once a year? Have we done a urine test to test for protein in your urine, and that protein is called microalbumin? Have we checked your cholesterol levels, and are we working to control your cholesterol? And have you had regular dental exams? Some other things that are important to me are blood pressure management, because it's integral for managing your diabetes also. Also real important to me, and I'll touch upon it later, is are you having low blood sugars? And then finally, do you use tobacco? Are you a smoker? And what steps have you taken to at least reduce your smoking or to think about quitting? Well, diabetes is based on blood sugars. And so I'm going to stress this as one of my most important slides. I encourage my patients to bring their blood sugars to clinic. I encourage my patients to check their blood sugars. It's crucial, and I describe it as our roadmap. That's how I can kind of tailor your care, and your endocrinologist or your primary physician can direct your care. It's good to keep a record of your blood sugars, because I think if you write them down, it cements it in your mind, and it also challenges you to make changes in your life. Once again, check your blood sugars, and you do it at the intervals that your care provider recommends. It's also good, I have patients that put notes and comments why their blood sugar went low or why it went high. There's typically an explanation for most of the time that you can say why your sugar has gone out of the normal range. And I really love my patients to bring their sugars to clinic. It's hard to direct care if it's a blind, if I have to make blind changes just based on a 3-month average. Also real important if you're sick or you have taken steroids or you've gotten a steroid injection, those are typical times where your blood sugars can go higher. Illness causes your sugars to go higher. Stress in your life can cause your sugars to go higher. Steroid injections, steroid pills like prednisone can cause your sugars to go higher. So the goals of my talk, first and foremost, why are we here and why is diabetes important and why is it important to control and manage diabetes? And that's all based on complications. Secondarily, we're going to talk about the signs of low blood sugars and the signs of high blood sugar. Our next would be to discuss the important lifestyle factors that do impact sugar control, which includes your diet and your exercise. We're going to talk about medical management of diabetes. I'm going to touch on different pills or oral agents that we take for diabetes, and I'll also touch upon insulin a little bit. And finally, I have a list of resources available for diabetics. I'm going to keep coming back to this slide. This shows the balance of control of diabetes. Diet, exercise, and medication. And they're all integral into managing your diabetes or helping your loved one manage their diabetes. So why should we manage diabetes? This is just a slide on some of the complications that I'm concerned about as a physician with regards to diabetes. Diabetics are at increased risks of stroke. They're at increased risk of heart disease. More diabetics have high blood pressure. Diabetic eye disease is a concern, and that's why I encourage my patients to have yearly eye exams. The kidneys are important as far as diabetes, and we regularly monitor kidney function and the ability of the kidney to filter. And then a problem area for a lot of my patients, they develop neuropathy because there's changes in the nerve fibers and they have uncomfortable sensations in their legs. And so neuropathy is another issue. And finally, it's important for diabetics to check their feet because there's foot problems. And what I mean by that is if you have neuropathy and you've lost some sensation in your feet, you can easily cut your foot or cause an injury to your foot that goes unnoticed if you don't inspect your feet regularly. This is a little more in depth. This talks about the changes that happen with retinopathy. Diabetics have what we call macular edema in the eyes. They develop glaucoma. And then there's some specific changes as far as vessel changes in the eye that impair vision. Heart disease, the development of atherosclerosis is the important factor as far as diabetes and heart disease. The kidneys, nephropathy, there's damage to the individual units and they're called glomeruli, and they're the filtering units of the kidney. And that's where we measure the microalbumin to see if the protein is getting through that unit when it's not supposed to. And then finally, the peripheral neuropathy. And another thing I didn't touch upon is autonomic neuropathy, meaning some diabetics develop impaired function of their stomach, emptying, and they develop what we call gastroparesis. That means the motile waves of the stomach don't work effectively to move the food forward, and thus they have stomach discomfort and stomach pain. But there can also be bladder issues related to diabetes. And males can experience erectile dysfunction additionally. This is a very important topic to me, and I think it's necessary that we hammer it in. What are the symptoms of high blood sugars, but also as important or more important are what are the symptoms of low blood sugars. But I have listed here some of the symptoms of high blood sugars. Increased thirst or dry mouth, increased urination at night, especially at night. It can happen during the day also. Individuals can develop blurred vision. You can be excessively tired. I've had patients who've had high blood sugars, and once we get them down, they feel tremendously better. They can have unplanned weight loss at times. They can have numbness and tingling in their extremities, and they can have an upset stomach and some abdominal discomfort or some diarrhea. So how do we treat this? It's important with your physician that you have a treatment plan so you know what to do when your blood sugar is high. Okay? Not just when it's low. It's important to know what to do when it's high. It's a little more difficult when you're on pills for your diabetes, oral medications, because there aren't many changes that you can take. But I think a hardline rule and a good rule of thumb is if your sugars are regularly over 300, you're at risk of having dehydration, and at the very least you should contact your primary doctor. If the sugars are running greater than 300 and you're not able to drink liquid or eat food and you're having nausea and vomiting, that's when you need to go to the hospital. Okay? That's an important distinction. If you or your loved one with diabetes is having nausea or vomiting and they're not able to take in fluids to counteract the dehydration, then that's a sign where it's past the point that you can manage it at home. Okay? I do want to say if you all have any questions, please raise your hand. I don't mind interruptions during the presentation. I don't want you to miss your chance. Okay? But if the sugars are high, it is important to drink water, and that helps to flush the kidneys and such. And then the 300 rule, which I just talked about. Low blood sugars. Some of my patients here can attest that, you know, I will preach the line that high blood sugars will kill you over 30 to 40 years. A low blood sugar will kill you immediately. Okay? Yes, ma'am. So how high is too high? That's what she asked. Like I said, I think it's kind of based on the individual person and what your sugars typically run. So if you're typically in the 100s and your sugars are all of a sudden running in the 200s, I think it would be in your best interest to contact whoever's directing your diabetes care. But as a hardline rule, I do think that dehydration and those type symptoms are more prominent if your sugars are running 300 and above. Okay? That doesn't mean that the 200s are not important. If the 200s are a real departure from where you are naturally, then it needs to be addressed. And it doesn't need to wait for the next 3-month visit, okay? Okay. Yes, that's real important that you talk to your provider about that. Okay? Any other?
For a period of time?
That's a very good question. I think I was trying to think of what the right period of time to tell you is. If you're a type 1 diabetic, 6 hours is the hard line rule. I think if your blood sugar does not come down or does not improve within 24 hours, if you're a type 2 diabetic, then you should notify us.
I have a question about neuropathy.
Sure.
This is going to sound weird, but in the restroom at the other Cornerstone office, there's the big sign about neuropathy. And it says there that you can get it in your legs, feet, hands, and it can also cause carpal tunnel. I don't understand that.
I haven't seen any patients personally. I do know that that's on the list, that they
Yeah.
do say that it kind of, I guess,
For that, because of the nerve.
causes progression of that type of thing. I do think you have to have the type of hand positions and that type of thing to develop that. But you know, the neuropathy can present in all different forms.
Like
Typically, it's
sleepy
like a glove appearance, and it's a numbness and tingling, or it's a burning. But I've had patients mention all sorts of symptoms.
Okay.
So,
What's the difference between type 1 and type 2?
good question. So, type 1 diabetes typically occurs in younger individuals. They're diagnosed earlier. And the problem is that the body attacks itself and attacks the beta cells in the pancreas that make insulin. So reasonably quickly, type 1 diabetics don't make insulin, and that's their problem. They do not make insulin. Okay, so they have to have insulin to live. Type 2 diabetics are usually older adults, okay, 30 years and up. And what happens in older adults is Americans have, and the whole world, but Americans specifically, have developed obesity. And when we develop obesity, our body doesn't respond to insulin as well. So the first problem with type 2 diabetes is that you make plenty of insulin, and your pancreas actually works harder to make more insulin, but the body does not, the tissues, the muscles, the liver, it does not want to take up the sugar. It's just basically saying no. And so the pancreas makes more insulin to overpower the system. Well, eventually in type 2 diabetics, over a long period of time, and I can't remember the duration of time, but sometimes they do eventually have impairment in making insulin too, to some extent. So that's a very good question.
Is that the reason for using metformin?
I promise you, I will get to the medications. We'll talk specifically about metformin. Okay? Can you hold off? All right. So, signs of low blood sugars. This can be variable with individuals. Some people will, and you're welcome to share any symptoms that you get when your sugar is low, but typical symptoms is sweating, shaking, being more anxious than usual. Sometimes males actually get angry, feeling weak. Some people have visual disturbances, headache, and then, like I said, there are other symptoms that someone will say, I know my sugar is low when this happens, okay? And here's just another cartoon with the symptoms of low blood sugar. Like I said, a low blood sugar will kill you immediately, and so I think it's crucially important that that's addressed by your diabetes care director or provider. So how do you treat a low blood sugar? What's important is you develop a care plan with your doctor, but just to give you a hard line rule, if your sugar is lower than 70 on your meter, there's a 20-point variation in meters, so your sugar's easily 50 at that point, okay? It's easily 90, but it's easily 50. And so I would want you to treat your sugar. And what I mean by treating your sugar is to take carbohydrates, okay? And there's a list there on the screen of carbohydrates. Sugar packets, you have to take 3 or 4 of those to get 15 grams of sugar. Fruit juice, soda pop, 4 ounces will give you 15 grams of sugar. A couple pieces of hard candy, 3 to 5 pieces. Pure sugar, 4 teaspoons. Or glucose tablets, which are available at Walmart and any drugstore. But what I would want you to do, if you show that you have a low blood sugar, you immediately treat the blood sugar, and then you wait 10 to 15 minutes. And then you recheck your sugar, and if it isn't going up, above 70 and going up, then you have to retreat. And you do it again, and you continuously follow that until your sugar is up. Okay? And once you get it up, that doesn't mean you're specifically in the clear. It could just be up for about 30 minutes. So hopefully you're near a time where it's mealtime and you might eat a little something more. If it's not near mealtime, at that point they recommend eating some crackers or some peanut butter and that type of thing. But I want you to get pure sugar at first to get your blood sugar up, okay? So if you have more than two or more of sugar 70 or below, you need to contact your doctor, okay? I call it a warning sign or a trigger sign, and it could portend to a really low sugar. Not necessarily, but if you're having 60s and 50s, who's to say the next one's not a 30 if you had exercised or done something or had not eaten enough? So I don't like that warning sign, and so I call 2 sugars less than 70 a trend, okay?
No matter how far apart they are?
2 within a week, yeah.
Wow.
2 within a week. And then the question is, when you do have a low blood sugar, if you are putting your sugar on a record and you're writing them down, then you can think back, well, what did I do in this time period? Where is the mismatch? What is the problem? Was I more active today? Was I working in the yard? Did I change my meal? Did I try to eat lighter today than I usually eat? Or, did I drink alcohol? So there's usually some explanation that can kind of let us know why the sugar is acting like that, okay? So let's talk about lifestyle factors, diet and exercise. Once again, balance, the balance between these 3. So a few tips concerning diet. Eat regular meals, and some patients are working with nutritionists, and I always support their recommendations. But I think it's important that you try to eat at regular time intervals, meaning you eat breakfast about the same time every day, you eat lunch about the same time every day, you eat supper generally about the same time every day. I think if you control as many factors as you can, you'll do a better job with your blood sugars. Improve your variety. And I will say something later on that will contradict this, but I do think that you should get a well balance between, meats, vegetables, fruits, breads. So get a broad array in your diet. Decrease your fat intake. Fried foods are just not good. Fatty meats are not good. And whole milk, which is one of my favorites, that's not good. So, no. Decrease your sugar intake. Drink plenty of water and try to eat less salt. A lot of the processed foods that we eat, especially the canned foods, have quite a bit of salt in it. So it's important for individuals with diabetes, especially ones who have hypertension, to watch their salt intake. And this is just a loud slide. But what I want to impress upon you is if you can get some information, if you have any concern on knowing what a carbohydrate is, which is turned directly into glucose in our bodies, that you should find a resource where you can know exactly what your carbohydrates are, because they'll raise your blood sugar. I impress upon my patients, know what carbohydrates do to your blood sugars, and if they cause wide excursions in your sugars, to eat less of them at the very least, okay? These are just some points that I've kind of developed through the years. I've already mentioned the first one. Diabetics that do better tend to eat the same things at meal times, at the same times. I don't want you to sacrifice variety, but I do think that if you're eating breakfast, you typically eat the same 2 or 3 meals. If you're eating lunch, you have only a small amount of variation in what you eat. And then supper's typically the meal where we have the most variation. But a lot of people eat sandwiches for lunch. A lot of people have either cereal, eggs or toast or something for breakfast. So I think, especially for our diabetics on insulin therapy here, controlling those foods that you eat means better blood sugars. Absolutely. So this is from the 2008 Physical Activity Guidelines for Americans that they've tried to hammer home. I think for all of us here, the recommendation is 150 minutes of moderate exercise. They describe moderate exercise as a brisk walk. And you should spread that over 70 days. So if you're looking over a 7-day period, about 22 minutes a day will get you to that goal. Or 5 days a week, 30 minutes. And they do say that you can do 10 minutes at a time is fine. So if you do 3 10-minute walks in a day, that's as good as a 30-minute walk just about. Break it up in chunks. But any type of aerobic activity will get you breathing harder and will get your heart rate beating faster. And they do break some of the recommendations into light, moderate, and vigorous. The vigorous recommendation is 75 minutes a week of vigorous exercise. But I think the majority of us would be in the moderate category for exercise.